Welcome to our presentation on developing clinical judgment with an innovative case study approach. We're excited to share ideas with you. This poster presentation is a collaborative effort from Professors Jacinta Shin and Janice Sinoski from the University of Lynchburg School of Nursing. We look forward to telling you about our poster. My name is Janice Sinoski, and let's start with a quick definition of clinical judgment so we are starting on the same page. Clinical judgment is a critical component of nursing practice as it allows nurses to make decisions based on a patient's unique situation. Developing clinical judgment in nursing students is essential to ensure they are adequately prepared to provide safe, effective, and efficient patient care. Why is this topic so timely, Jacinta?
Well, back in 2020, the NCSBN recognized that in spite of high NCLEX pass rates, the instances of practice errors were increasing. And this suggested that the NCLEX was not an accurate assessment of new graduated nurses' clinical judgment skills. A systematic review by the NCSBN found a concerning number of patient errors related to poor clinical judgment. Also, they discovered employers' dissatisfaction with new grads' clinical judgment. New nursing graduates could recognize patient deterioration, but were unable to explain appropriate nursing interventions. As a result, the NCSBN redefined clinical judgment and developed a clinical judgment model to better prepare newly graduated nurses and change the NCLEX format to improve methods of assessing clinical judgment. As a result, it's vital for nurse educators to update teaching practices to prepare students for the next generation NCLEX and strengthen clinical judgment skills to improve patient outcomes.
Our approach to developing clinical judgment in nursing students is through the use of a reverse case study, a strategy in which students develop a scenario about a patient from limited data presented to them. The use of a reverse case study in nursing education has several benefits. First, it allows students to understand better the decision-making process involved in patient care. By working backward from a patient's outcome, students can see how different decisions and actions could have affected the patient's condition. This process helps students develop critical thinking skills necessary for making sound clinical judgments. Second, the reverse case study method promotes active learning consistent with Kolb's experiential learning and Knowles' principles of adult learning. We know that Kolb's experiential learning theory and Knowles' principles of adult learning are two powerful frameworks that can be used to support teaching through reverse case studies. Kolb's experiential learning theory is based on the idea that people learn through experience. Reverse case studies can be used to facilitate all four stages of Kolb's learning cycle. According to Knowles, adult learners are self-directed and prefer a learner-centered environment that fosters collaboration, critical thinking, and problem solving.
By combining these frameworks, instructors can create a powerful learning experience that engages students and supports their unique learning needs. Reverse case studies provide a valuable tool for teaching critical thinking, problem solving, and collaboration, while also helping students gain a deeper understanding of the content. With these frameworks in mind, educators can create a dynamic, engaging learning environment supporting student success. Here's how it worked. For our interventions, we have students work in small groups and randomly assigned each group a prompt, including some of the prompts were a patient in a labor and delivery suite, a homeless patient with an alcohol use disorder, a pediatric patient in the emergency department, a patient with shock in the intensive care unit, an elderly patient in a pre-op holding room, a patient with a mental health crisis in a rehab facility, and a med-surgical patient awaiting discharge orders. Faculty provided a set of instructions, and students worked in groups to create a case study corresponding to their prompt. Faculty shared a master slide presentation, and each group added slides of an assigned color. Students spent about 90 minutes of class time on their project. We circulated the room to answer questions. The groups presented their case studies during subsequent classes and engaged their classmates in critical thinking as they progressed through the case study. The master slides presentation remained accessible to the students to review after class. Janice, you want to explain the instructions?
Sure. In our instructions for completing the case study, we started with a slide presentation and gave students editing access to the presentation. The first slide provided instructions for completing the case study. We created a slide for each group with the prompt and assigned color for their group. Each group added slides in their assigned color to address all content in the instructions. The students were engaged as they worked in groups to create and present their case studies. The student feedback was positive and reflected enthusiasm about the creative process of not only constructing the case study and the benefits of content review, as well as the application of content using clinical judgment.
Janice, maybe talk a little bit about how this would work for online learning.
Yes, the reverse case study is easily integrated into an online learning environment using breakout rooms. Online students can record their presentations or present their slides synchronously or asynchronously and have students provide feedback through online discussion boards. Jacinda, why is this technique so effective?
The reverse case study method is an effective way to prepare students for clinical practice. By working through case studies, students can develop the skills and knowledge necessary to provide safe and effective care to the patients. They can practice making sound clinical judgments and learn from their mistakes in safe, controlled classroom environments. Reverse case studies have become an increasingly popular teaching strategy among nursing faculty. This teaching method involves presenting students with a clinical scenario and asking them to identify what went wrong in the scenario and how it could have been prevented or managed differently. Reverse case studies are especially useful for nursing faculty as they help improve clinical judgment among students.
So we use the reverse case study in nursing education as an effective way to develop clinical judgment in our nursing students. This method promotes critical thinking, active learning, allowing students to apply their knowledge to real-world situations. By developing their clinical judgment skills, nursing students can provide safe and effective care to patients in a variety of healthcare settings. Jacinda, can you talk about some of the other benefits?
Yes, one of the main benefits of using reverse case studies as a teaching strategy is that it encourages critical thinking among nursing students. By presenting a scenario where something went wrong, they're forced to think about what could have been done differently. This type of reflection promotes active learning and allows them to apply their knowledge and skills in a practical way. Then they're better able to handle real-life clinical situations. Another benefit of using the reverse case study is providing a safe environment for them to learn from mistakes.
However, we should mention several challenges to using reverse case studies as a teaching strategy. One challenge is the lack of real-world experience among students. While reverse case studies provide a safe environment for learning, they may need to fully prepare students for the challenges they will face in the real world. Nursing faculty must ensure that students are allowed to gain practical experience in addition to classroom learning. Another challenge is the need for faculty to develop effective case studies. Creating effective reverse case studies requires a significant amount of time and effort on part of the faculty. The scenarios presented must be relevant and engaging for students while providing learning opportunities. Faculty must also be able to facilitate the discussion following the case study's presentation. They must do that effectively. The outcome of student-centered learnings are influenced heavily by faculty and student factors such as the level of engagement and participation and ability to accommodate change. Faculty must be able to effectively facilitate the discussion that follows the presentation of the case study.
Unlike traditional case studies, reverse case studies may not have a clear answer, and that can make it difficult for instructors to provide feedback. Learners can also struggle to evaluate their own work, and this can lead to uncertainty about the quality of their solutions. Reverse case studies often require learners to work in groups, and we know that this can present challenges related to communication and collaboration. Nursing faculty must also balance these challenges with the benefits of using reverse case studies to ensure that students are fully prepared for the challenges they'll face in the real world. Clinical judgment is an essential skill that nursing students need to develop in order to provide safe and effective patient care. As the healthcare industry continues to evolve, classroom nurse educators play a crucial role in preparing students to make sound clinical judgments in diverse and complex situations. Here are some classroom strategies that we as nurse educators can use to foster clinical judgment in nursing students. Reflection can help students become more aware of their decision-making process and the impact of their decisions on patient outcomes. By encouraging reflection, classroom nurse educators can help their students become more effective and efficient in their practice. As teams work in groups, teamwork and collaboration skills are enhanced. Feedback is essential for developing clinical judgment skills in nursing students. Faculty and peers can provide feedback about clinical decision-making processes, identifying areas for improvement and celebrating successes. And this can help nursing students better understand their strengths and weaknesses, which can inform their future clinical practice.
We promote self-directed learning, as reverse case studies require learners to actively participate in their learning, researching and analyzing the case before applying their knowledge to solve the problem. This promotes self-directed learning, which can lead to increased motivation and student engagement. This strategy engages students with different educational needs and preferred learning strategies. Activities like this foster creativity, often open-ended problems, allowing learners to explore different solutions, think creatively, and develop innovative solutions to complex problems.
Reverse case studies require learners to use their prior knowledge to solve problems. However, if learners lack the required knowledge, they may struggle to identify relevant information, and their case studies may lack depth, making them less effective tools for content review, application, and critical thinking. Creating reverse case studies can be time-consuming for both learners and instructors. Instructors may carefully develop and select appropriate case studies, while learners must research and analyze the case before applying their knowledge. Overall, reverse case studies can be an effective teaching approach, but instructors and learners must be aware of these potential challenges and work to overcome them.
Well, thank you for joining us. In conclusion, developing clinical judgment skills is critical for nursing students, and classroom nurse educators play a vital role in fostering these skills. To see our references, please scan the QR code. Our contact information is available at the top of the poster, and we thank you.